Weeks, just getting so much good food this weekend. Hey, let's talk about your health. And sometimes it seems like sickness or disease kind of comes out of nowhere. But Dr. Art, there's good news because you're saying there are 5 things actually that we can prevent and we can start today.
Actually, it's really incredible because there are 5 preventable conditions that contribute to a lot of these problems. Those conditions, number 1, are obesity. So people, again, are overweight. You don't realize how much that contributes to so many diseases. In fact, it's 47% more likely to cause problems than even tobacco, which is another one of the preventable conditions. There's hypertension. There's hyperlipidemia, which is a high cholesterol level, and there's also diabetes. So many of these conditions can actually be treated. You can get them under control, and it can help to let you live maybe even 10 years longer by reducing some of these conditions. So the obesity, number 1, again, you want to eliminate certain foods, the pasta, rice, potatoes, and bread. With the high cholesterol, there are medications that you can take. So there's statin drugs that they often use to treat these. Repatha is a new one that's just came out. It's an injectable, and you can get an injection twice a month. That helps to lower cholesterol, particularly the LDL cholesterol, which is the worst part of it. That's the bad cholesterol. So that's one thing you can do. If you can't take the statin drugs, you may want to consider that, particularly if you have a high family history of the high cholesterol. You know, the diabetes, I have patients that come into my office and they often say, well, I ran out of my medications and I haven't taken them for 2 or 3 months, and they're sugar winds up being 200, 300, and so you can't stop taking your medications if you have diabetes. A lot of times people think they can get away with not taking it for a few weeks. It's going to cause not only the risk of losing your eyesight and neuropathies and things like that, but it's potentially going to affect your kidneys, and that's the number 1 cause of death after you reach the age of 75 and 80. So there are a lot of things you can do. If you have high blood pressure, take the medications as prescribed by your doctor. That's going to help to protect your kidneys and your liver as well. I think with people out there, these 5 conditions are actually treatable very easily if you take the time to exercise, diet, follow your doctor's prescriptions that he has prescribed for you. And so there's a lot of ways to reduce these conditions, which, again, are going to extend your lifespan up to 10 years if you do.
And improve your quality of life during those 10 years.
Right, exactly, and allow you to function autonomously, independently when you get older. So when you are, say, 70 years old or 75 or 80, that you're still able to function on your own if you take care of these conditions. But the interesting thing about this new study was, again, the obesity. And that contributes to so many different diseases, then people can potentially, you know, extend their lifespan.
Yeah, and avoid.
And avoid it, yeah.
Now, I don't know if this is going to help with your health, but it is going to help, though.
Yeah, exactly.
You have a your celebrity golf tournament coming up.
And that's on Sunday. Scott Passmore is going to be out there. So if you haven't registered, go on to mollenfoundation.org and you can register, and it contributes to helping to fight obesity in children.
And where is it?
It's going to be at the Camelback Inn, at the Camelback Golf Course, and it's on Sunday at 7 o'clock.
I mean, hey.
It's going to be fun. And Scott Passmore is going to be there.
Does it count as exercise? Tell us that.
Yeah, absolutely.
Okay, perfect.
No question about it, especially if you hit a hole-in-one, because you'll get your heart rate up to about 175 beats a minute, and you'll get a lot of benefits.
Okay, all right. Well, there you go. Shoot for that
hole-in-one. And you win a Maserati if you win a hole-in-one.
Is that true?
Yeah, yeah.
Well, there you
Maserati,
go, my friend.
Hole-in-one.
Well,
come on out.
A lot of reasons to be there.
Camelback Golf Club.
Thank you.
Okay.
Appreciate you.